24,000 references on PubMed. How much fish oil? If you've got people that are really obese, like 200 pounds, you want to use high doses of fish oil, 20 grams. If you're a lean athlete, 4 or 5 grams. And try and use pharmaceutical grade when there's less than 10 parts per billion of mercury. Keep it always in the fridge so it doesn't oxidize. Always take it with meals because you get 30% more absorption. And it's good stuff. Good for the skin, hair, a lot of other things. Just a Mediterranean diet, which I think the paleo diet, according to a friend of mine, Lauren Cordain, they've got 5 or 6 articles now that looking at the paleo maybe being as good or better than Mediterranean. But most people are familiar with the Mediterranean diet. Lionheart study, a Mediterranean diet associated with a 70% reduction compared to the American Heart Association diet. DART trial again, eating oily fish twice a week, 32% reduction. Reducing the Gc trial, taking fish oil, decreased risk of sudden cardiac death, 45%. Fish oil stabilizes a lot of things. EPIC study, same thing. Harvard School, Mediterranean diet, you get the picture. Alzheimer's, very much like type 3 diabetes. Mediterranean diet, reducing the risk of it. So, just to summarize and finish, the cardiometabolic disease, they're all thinking it's a disorder of lipid, new thinking, carbohydrate, not the plugging up of pipes, but more systemic inflammation. Look at the cholesterol in the old model, look at the lipoproteins. LDL cholesterol is not the best predictor. LDL particle number is the best predictor. If you're under 750, you're pretty much bulletproof. Statins versus paleo diet. Stents bypass versus intensive care. Treat the symptom. In the old model, we treat the cause, and we move to a sick care. Just a quick thing to show the difference between paleo diet and plant-based diet. Apart from meat and eggs, legumes, nuts, fine, veggies, but all these others, no dairy, no refined carbs, no vegetable oils, omega-3 is good, alcohol in moderation is good. Very little, watch the tropical fruits, mangoes, bananas, dried fruits like dates, raisins. Fruit juice is a killer. In Lustig's book, he shows that even if it's freshly squeezed, for most of us, it has more sugar in it than a Coke. So liquid carbs is one of the reasons we're seeing this tremendous obesity epidemic and diabetes epidemic. And then we monitor people with the software. We load a few hundred biomarkers and health indicators so we can track people to make sure that the program is doing what it should be doing. And these are just the ways we monitor people. So I implore you to look at a proactive model, personalized, predictive, preventive, participatory. And the secret of a long life, I walk every day, work in my garden, eat fresh food from the earth, see, enjoy my midday meal with a glass of wine, surrounded by friends and family. Good way to live our lives. Thanks very much.
Thanks very much, Dr. Graham Simpson. And it's interesting that the diet that he recommends is the same diet that we recommend with GcMAF. Right, we're now going to hear from Steve Cronin, the CEO of OnLife.
And thanks very much, Steve.
Hello ladies and gentlemen, today I want to talk to you about hyperbaric oxygen therapy. I think it's interesting to see how well this fits in with what Dr. Simpson was talking about and what the lecturers on GcMAF, both for cancer, for autism, think this is an interesting therapy that bridges across all of those. So when people mention oxygen therapy, what do people think of? It's usually Michael Jackson, unfortunately. Perhaps they should be thinking about me. Here's a photo of me in 1933. I still look okay. It's a tribute to the benefits of hyperbaric oxygen therapy. How I got here is I run a company that introduces innovative physiotherapy and rehabilitation equipment to the Middle East. This is one of our oxygen chambers. It's made in the UAE using Australian technology. And we initially started using this for sports science, for helping athletes recover faster after training. But I get many calls from parents of children with autism and other disorders, from cancer doctors, from neurology doctors. And so our interest has moved and become much broader away from sports science. So why should you be interested in hyperbaric oxygen therapy? I see it as another tool in your toolbox. It's not a magic bullet. It's not going to cure people overnight. But it is something that you can use as an adjunctive therapy in addition to other treatments, GcMAF, diet, etc., etc. And it has fairly minimal side effects. It's been used to treat a wide range of conditions. Here's just a few: diabetic wound healing, stroke, autism, and other autism spectrum disorders, MS, ME/CFS, mitochondrial cytopathy, cancer, sports injuries, traumatic brain injury. From an autism perspective, there's a lot of testimonials saying our child made huge strides in speech, in language skills, reasoning skills, bowel movements, interactive play, integrative questions, all the things that you really want to see with your children. Now, obviously, this isn't for all children. People respond very differently to the therapy. And also, these are just testimonials. We also have studies. It's a pleasure to be here today with some of the people who actually wrote these studies, like Dr. Bradstreet, Professor Kanegi, and also to be here with parents who may not know much about oxygen therapy. So I apologize to those people on both ends of the spectrum, the experts and the people who may not know very much. I'm going to try and steer a course down the middle in terms of what I talk about. So some of the results we see in autistic children: improved immune functioning, improved fine and gross motor skills, improved muscle tone, improved language, mental alertness, calmness, decreased sensory hypersensitivity. So what is hyperbaric oxygen therapy? Essentially, it's inhaling increased levels of oxygen, up to 100% oxygen, at pressures that are above normal atmospheric pressure. We're talking about 1.3 to 3 atmospheres of pressure in a pressurized chamber. Now, pressurized chambers aren't new inventions. They've been around for many hundreds, maybe even thousands of years in various formats. I don't think I would get into any of these contraptions though, personally. For me, hyperbaric medicine really took off in 1960 when Dr. Barama demonstrated that animals could survive without red blood cells in hyperbaric oxygen conditions. So he took a farm animal and placed it in a hyperbaric chamber at 3 atmospheres pressure, and he removed all of their red blood cells. And the animal showed no visible signs. Both the anatomy and the vital signs of the animal were totally fine, which showed that you could still deliver oxygen to the tissues without red blood cells. And the way that was happening is that the oxygen was dissolving under pressure into the liquid of the blood and being transported around the blood. And this is where people really started to take notice of hyperbaric oxygen. Today there's two main types of hyperbaric oxygen chamber. You have hard chambers, either monoplace for individuals or multiplace for multiple people at the same time. They tend to work at higher pressures of 2 to 6 atmospheres, but you can also use them for 1.5 atmospheres. Higher oxygen. The thing to note about these is that they're very expensive and they require skilled technicians. You typically see them in clinics or hospitals. There's an alternative for clinic use and for home use, which is the soft chambers. They're portable, you can fit 1 or 2 people in them. Typically work at lower pressures, 1.3 atmospheres. At a push, maybe 1.5 atmospheres. Lower oxygen from 21 to, if you have a mask, you can deliver up closer to 100%. And relatively inexpensive, and something that anyone can use in their home. So the aim of the hyperbaric oxygen therapy is to increase the amount of oxygen in your blood and other fluids, such as cerebrospinal fluids, to increase tissue oxygenation. And the way that this works is that you increase the pressure of the gas, and therefore more gas, more oxygen dissolves into the blood plasma of your blood. Everyone knows what pressure is, but let's think about what's actually causing this pressure. Is you being continually hit by billions of gas molecules in the air. I'm going to be talking quite a lot about atmosphere's pressure. Obviously at sea level, this is 1 atmosphere. If you kind of duck dive to like 3 meters in the water, that's about 1.3 atmospheres. So if you see a mild hyperbaric chamber, the pressure on your ears is going to feel about the same as you diving down to 3 meters. If you're diving down to 30 meters, you're getting about 3 atmospheres pressure. So what does this mean? It means that and when you open your mouth and you take in a breath at 21% oxygen and sea level pressure, you're going to get in a certain amount of oxygen molecules that are going to come flying into your mouth. If you increase the pressure or you increase the amount of oxygen, you're literally just bringing in a lot more oxygen in with every breath. And it's really as simple as that. So in the physiology, what this means is that a lot more oxygen is getting into the lungs, which is then transferring into the blood plasma. So under normal conditions, you'll see that the red blood cells, which are very efficient, are almost completely saturated anyway with oxygen, but there's really not a huge amount of oxygen dissolved into the blood plasma. Simply increasing the pressure to 1.3 atmospheres and 100% oxygen, you get nearly 10 times the amount of oxygen dissolved in the blood plasma. And the thing about oxygen dissolved in blood plasma is that it's much easier for the oxygen to diffuse into cells. If you have problems such as inflammatory problems, if you have a lot of interstitial fluid in between the cells, it's going to restrict the ability of the oxygen to get from the red blood cells through into some of the cells, and they may become hypoxic. With the oxygen dissolved into the blood plasma, it's much easier for the oxygen to diffuse into the cells at higher blood pressure, at higher partial pressures of oxygen. It's going to get into the cells much more easily. So what? What this means is that you can get the oxygen to penetrate much more deeply into tissues and into the cells that may be hypoxic. This promotes healing, it can stimulate the immune system, it can compensate for poor circulation. It may not be inflammation, you may have had surgery, you may have diabetes where your microcirculation is impaired. If the red blood cells cannot get to or near the areas of tissue, then you're going to have hypoxic problems. With the blood plasma, it's much more easy for that blood plasma to get closer to these tissues and therefore for the oxygen to reach them. You can also treat neurological issues with lower pressures. We're talking about 1.3, 1.5 atmospheres. And therefore, without any strong side effects like oxygen toxicity from higher pressures, like 2 atmospheres and above, you can treat neurological issues relatively straightforwardly. Now, this is a continually evolving field. I wanted to give you some reasonably up-to-date examples. This was published just over 2 weeks ago. There's a very nice study showing that hyperbaric oxygen therapy can improve brain activity and cognitive performance years after traumatic brain injury. So these patients had post-concussion syndrome. They had neurocognitive impairments between 1 and 5 years after their traumatic brain injury, often in car crashes. And they had 40 sessions of hyperbaric therapy, just at 1.5 atmospheres, 100% O2. And the patients were asked to conduct a range of studies assessing neurocognitive abilities, and you can see both in uncontrolled patients and patients who had control assessments and then went on to receive oxygen therapy, you can see a pretty large and significant increase in their performance across a wide range of cognitive skills from the oxygen therapy. So this seems like a relatively easy way to treat people with traumatic brain injury, even many years after they've had the initial problem. And here's a nice brain scan. So this is looking at the metabolic activity of the brain. You can see in the control here, there's really very little change, but after hyperbaric therapy, you can see the colors here, the red and the white. You're getting a 20 to nearly 30% increase in the brain activity of the brain in these patients after hyperbaric oxygen therapy. So even just last month, you're getting some really nice studies coming out about the potential of oxygen therapy. And of course, if we bring that back to autism, there's been studies that show decreased perfusion of the cerebrospinal fluid in the brain. So this is potentially relevant to autism as well. So the benefits from hyperbaric oxygen therapy, it seems that we can improve several disorders that are shown implicated in not just autism, but in a wide range of conditions, and also in the conditions that we're looking to use GcMAF to improve. So, cerebral hyperfusion, neuro and gastrointestinal inflammation, oxidative stress, mitochondrial dysfunction, like Dr. Simpson was talking about earlier, immune dysregulation, dysbiosis. And I just wanted to dive into some of the details here about some of the possible mechanisms for this, and for you to think how this might apply to autism, to cancer, to inflammatory diseases. I think it's fair to say we don't fully understand the mechanisms both of these diseases and both of hyperbaric oxygen therapy. So it's still relatively early days. But having said that, I think we're making a lot of progress in both animal models and human studies to understand what's actually happening at the cellular and physiological level. So let's look at neuroinflammation and inflammation in general, which has been implicated in a wide range of diseases, such as autism spectrum disorder, CFS, Alzheimer's, etc. And obviously, inflammation is closely related to the GcMAF studies that we've been seeing, and how GcMAF may potentially improve inflammatory disorders. So let's take a look at what's happening here. So with the hyperbaric oxygen therapy, you have an increase in the oxygen levels in the blood plasma. First off, this means that the oxygen, through simple diffusion gradients, can diffuse further through the inflamed tissues into cells. So, not only can you get further through the interstitial fluid to cells that may be hypoxic, also in general it's harder for the oxygen to get into inflamed cells, and therefore with the increased partial pressure of oxygen you can get the oxygen delivered more effectively into those cells. But that's not the only effect, and this is where it seems to get a little bit more interesting. The hyperbaric oxygen seems to reduce pro-inflammatory cytokines. So the molecules that are stimulating the inflammation, prolonging the inflammation, seems to reduce those, and it seems to promote increases in anti-inflammatory cytokines such as IL-10. Not only does it do that, it seems to mobilize bone marrow stem cells. There's been studies that have shown a 2-time increase in stem cells in wound areas, and this seems to be happening through nitric oxide synthase pathways. What this means is that you get increased wound healing, but you also get new blood vessels forming, being stimulated to form. So where you have problems in microcirculation, this is actually helping not only to deliver oxygen to the tissues, but over the longer term to actually improve the delivery channels for oxygen through the normal methods of delivering red blood cells to the area. And also, we're seeing an increase in the antioxidant enzymes against oxidative stress. Oxidative stress has been implicated in a wide number of diseases, and also an improvement in mitochondrial function. I just wanted to talk about these in a little bit more detail. So, oxidative stress has been implicated in cell death and also in disrupted cellular signaling. It's been implicated in a wide range of diseases, including, there's been numerous studies implicating this with ASD and autism. So again, the oxygen therapy increases the local oxygen. Somewhat paradoxical here, that people have been concerned that if you increase the level of oxygen, you're going to increase the level of oxidative stress. That would seem logical. But actually what seems to be happening here is some kind of priming effect, almost like vaccination in a way. What's happening is that there's a transient increase in reactive oxygen species, the free radicals that always get a bad press. And what seems to be happening here is that this leads to an upregulation of antioxidant enzymes, such as SOD, glutathione catalase. And what this is doing then is creating a kind of conditioning that has a protective effect, again, for neurons, for liver cells. These are the sort of cells that they've been studying, where you have a protective effect against further reactive oxygen species damage. And so the oxygen therapy exposure kind of primes the body, releases more of these enzymes, and protects the body against future oxidative stress, and can actually reduce oxidative stress levels. And what we also see in some studies of autistic children is that with oxygen therapy, you actually don't see an increase in intracellular oxidative stress. You're not seeing things like oxidized glutathione, which suggests that the oxygen therapy is not increasing the overall oxidative stress of the patient. Obviously, given suspected increased oxidative stress levels in autistic children, the last thing you would want to do would be to raise those. And actually, what you seem to be seeing is no increase there, and in fact, an increase in the enzymes that actually help to reduce oxidative stress. Let's talk about mitochondrial dysfunction, implicated in a huge range of diseases. Again, autism, Alzheimer's, but also diabetes, stroke, cardiovascular disease, and again, traumatic brain injury. So, the hyperbaric oxygen leads to an increase in the local O2. As we just mentioned, you see a transient increase in the free radicals, the reactive oxygen species, and what this seems to stimulate is increased mitochondrial DNA replication and transcription, and increased mitochondrial biogenesis and autophagy. What does this mean? New mitochondria being produced, and old, damaged mitochondria being eaten and broken down in the cells. Just to step back a bit, why are mitochondria important? Well, they are generating the energy in the cell. They are the energy sources. They're creating the ATP. If you do not have effective mitochondria in your cells, then you're going to have all sorts of problems, as seen in these diseases. We're also seeing a decrease in cerebrospinal fluid lactate levels, which suggests this is an indicator, the lactate is an indicator of mitochondrial dysfunction, and so we're seeing decreases there. We're also seeing increased ATP production in muscle cells, which suggests that the mitochondria are working more effectively. So you see here, just from the hyperbaric oxygen therapy, this is a relatively easy, pain-free, with few side effects, mechanism for improving mitochondrial function. Finally, some other, perhaps less thought of benefits of oxygen chambers. When you have an autistic child, firstly, the parents, if you get in the chamber, you get to relax, and you get the benefits from oxygen therapy yourself. If you're not in the chamber, you also get to relax. We all know that it's not easy. Being with your children, you get a little moment to just to relax. And also the oxygen chambers tend to be relatively low stimulation environments. And once the children get used to this environment, they actually tend to be calmed by it. There's not excessive stimulation that you might get in everyday life. So to summarize, oxygen therapy is a promising additional treatment. As I said, it's not a magic bullet, but it can be useful additional adjunctive treatment for a range of inflammation and immune-related conditions, such as the ones we've been discussing in the past couple of days, with few side effects. We have an oxygen chamber just in the conference room outside. Very happy to talk to you further, either today or any time if you're in Dubai. Thank you very much.
Thanks very much, Steve. Can we just do 2 questions, please?
Hi, Steve. This is a very nice presentation about hyperbaric oxygen therapy. Very conclusive. My question to you, have you had epilepsy or kids with abnormal EEG and you put them in the chamber? Do they get worse with epilepsy or do they get better?
What we have seen is, and again, how children react tends to be quite individual. You need to look at their case histories. There have been cases of hyperbaric oxygen increasing epilepsy and occurrences of epileptic fits in oxygen chambers, but that doesn't account for everybody. So I think the way to manage this is to look carefully through their history and what triggers the epilepsy, and also for those children to be carefully supervised. So I would definitely say it's something that you need to pay attention to, but that doesn't mean that epileptic children cannot use oxygen chambers.
Dr. Zoya Wojtenka.
Yes, thank you so much for the presentation. Quick question, right here.
Okay.
Here.
Oh, sorry. It's been a long day. Okay.
Could you please talk a little bit about pressures? What criteria do you use to choose pressures, and examples like things like meningioma or for autism or for post-traumatic stress or trauma?
Okay, a great question, thank you. Pressure partly depends on availability of equipment. So, if you only have access to a 1.3 atmosphere chamber, you may get some benefits that just take a little bit longer than if you have a 1.5 atmosphere chamber. I would distinguish between 2 broad categories. First is things like wound healing, diabetic wounds, things like that, severe trauma-related inflammation. There you may well want to use high pressures from 2 atmospheres and above. But it's been shown that with increased pressures and 100% oxygen, you start to see deleterious effects such as oxygen toxicity. You're actually putting in more oxygen than the body can easily handle, and the effects of the reactive oxygen species